Okay, I think we're going to get started, Dr. Nibber. So, welcome everyone, and thanks for joining us tonight here on YouTube for another online seminar. I'm Darcy Furness, the nutrition consultant here in the South Surrey location. And for those of you unfamiliar with our nutrition services, we do offer free nutrition education. So, in order to keep everybody safe during the pandemic, reach out to your Choices Markets and nutritionist that's local to you, and you can find out what services she's able to offer you at this time. So, and stay in touch with all things healthy by visiting our website at choicesmarkets.com. Sign up for our monthly newsletter, which will be neatly delivered into your mailbox for you monthly, which is great. Email. And you can also follow us on Facebook and on Instagram. So, let's. Couple of housekeeping details. After the seminar tonight, you're going to receive a email link that will ask you to complete a short survey and also ask you for your mailing address. And we want that to send you this nutrition coupon, which we like to call a nut buck. This entitles you to $10 off a $50 purchase, and you can apply it to anything in the store, including sale items. So you want to take advantage of that. If you have questions tonight for Dr. Nibber, you can use the chat function in the YouTube channel, and you need your own account to use that chat function. And we had mentioned that in the first email out to you. Now, don't worry if you don't have your own YouTube account. I'm going to be posting Dr. Nibber's website in the chat that you'll be able to see, and she'll also have it on one of her slides towards the end of her presentation. And you can go through her website, learn a bit more about the clinic, and contact her that way if a question you have is not answered tonight. So we're live streaming on YouTube. This is going to be fun, and you can come back and enjoy this seminar anytime you want. Choices YouTube channel. So we're happy to have you tonight. I'm delighted to introduce to you Dr. Navnirat Nibber. She is one of my favorite NDs, and I'm just going to read a little bit from her bio here. She has a passion for women's health, and her unique approach combines ancient healing practices with evidence-based innovative scientific therapies. She's a graduate from the Canadian College of Naturopathic Medicine. She's a medical advisor and a brand educator for AOR, which is also one of my favorite supplement brands. Simply put, Dr. Nibber's goal is to ensure that her patients are empowered to make sustainable changes towards their long-term health goals. Tonight, she's going to educate us about how we can become better advocates for ourselves in the often complex medical world. So without any further ado, I'm going to mute myself and take myself off video, and I'm going to let Dr. Nibber give us our talk. So welcome, Dr. Nibber.
Amazing. Thank you so much. And I'll pay you later for the comment on being your favorite ND. Love to hear that. So thank you so much, everyone. I so appreciate being here and having this opportunity, especially to connect in a time like this where I think it's always a little bit difficult. So I've had the good fortune of working with Darcy and the team at Choices many times now, and it's always just such a delightful experience. So I'm really appreciative that they've been able to transform this platform, as so many of us have had to do. So today, I really wanted to kind of get into. Oh, that's working. Okay. Um, so I just wanted to get this kind of housekeeping off the top. Um, e- the idea of this presentation is not necessarily to diagnose or treat or cure, and it hasn't been approved by Health Canada or reviewed by Health Canada. But really, the idea is let's make sure that we're creating a dialogue and a discussion so that we can have really meaningful visits with healthcare providers. And sorry, my okay, sorry, I was getting a little stuck. Of course, this is 2021, I guess. Um, so the reason this particular area is of such interest and I'm so excited to talk about is because again quite personal to me. I think, as many people have, um, experienced many different type of healthcare practitioners as a patient myself, and I really want to participate in making other people more active and engaged, so we can make the best decisions of our health. And my story actually began when I was a patient myself in my undergrad in university, and I had a particular experience that's kind of seared in my mind, where I was at an appointment with a healthcare practitioner, and it really left me feeling utterly unheard. I felt very shamed, and ultimately, it had not addressed the reason I came in. I went in for one thing and came out with a prescription for something else. And I just want to clarify, this isn't a criticism of medical doctors, as it's happened with many different types of healthcare practitioners, but it really did highlight kind of what I knew I didn't want to do. And it was a very transformative experience for me, and gave me a very clear vision of the type of practitioner I wanted to be and the type of experience that I think we are all due as patients. A type of experience that includes a very safe and secure environment. And I've noticed this thread even as being a practitioner myself, where I think we all want to be heard, and we all need to be engaged. So that's kind of one of the tenets of our clinic in South Surrey. In this presentation in particular, I hope that we can all leave feeling a little bit more confident about what our role is in our healthcare, about our rights, and what is the best way to kind of navigate the current system, which can be a little bit complicated. I want to go through the areas of your health that are influenced in some very different ways. I think more than ever, we need to examine what's within our control. And we're realizing that there are many factors outside of our control. So we'll understand those determinants of health and how it changes our risk for certain health conditions. We'll also review how we can improve our relationship with healthcare providers, and how healthcare providers strive to improve relationships and outcomes. And I think we'll get into a discussion about health literacy, as well as some of the tools that I think we need to develop to communicate with healthcare practitioners and vice versa, because it's very reciprocal. And finally, we're going to do a little bit of an assessment of some of the systems of medicine that are available around the world and where we rank. So first, let's kind of discuss what influences our health. These are determinants of health, and they're often very complex and overlapping. And nothing infuriates me more in this wellness space with, health influencers that just simplify things to the point of, well, just eat better and exercise. I mean, this is quite reductionist, and it really ends up sometimes blaming and shaming patients. And frankly, it doesn't really look at the reality of a situation where at any given moment, there is this incredibly complex interplay of our genes, our environment, our culture, our sex, our gender, socioeconomic status, our employment, our education, our geographic location and access to clinics, our personal health care, and our childhood. And all of these experiences and situations will influence our health. So first things first is that you need to contextualize and be aware of the fact that your health can be impacted by many, many factors, which you may or may not have, total control over. And I think we can move to starting to identify the factors we can control and the ones we can't. And of course, I can see that's an awful lot to ask, which is why I think it's helpful and necessary to have a doctor or a healthcare practitioner that's a guide that can help you delineate and parse out what you can work on and what you can't. So basically, to help you navigate those determinants of health. We call this therapeutic relationship, kind of the cornerstone of any doctor-patient interaction, and always strive to improve it, which is why we like the more lifelong patients and where we get regular interaction. And the better the relationship, the better the health outcomes. And there's a plethora of studies and research that are coming out to prove this fact. Now, much of this relationship is actually on the healthcare provider. It really is on us to make sure we're creating those safe spaces. We're actively listening and challenging some of those implicit biases that we're especially seeing now with systems of racism that have even infiltrated the healthcare space. And we took an oath to do no harm. And so know that this relationships is built on a foundation of trust and transparency. So in every regulated health profession, there is a code of conduct, and there are options for recourse that that if the providers breach this, you have options. And so I bring this up because it's very important for patients to be notifying these bodies and reporting professional misconduct, to have, when you have instances like this, to be able to have a forum and a voice where things can be escalated. And you're right, if you have a right to care with integrity. And if you feel as though your privacy or your safety or your health care in any way is compromised, this is why we have regulatory bodies. It's to protect the public. So it's important to understand what those regulatory bodies are for whoever you've gone to see, and just understand that you're able to launch. There's processes and recourse. For supplements, for example, there are adverse reaction reporting with Health Canada, and this also helps with the oversight and enforcement of a lot of these rules. So in knowing that there is this recourse and you have a forum, it also comes back to, are you getting informed? Is the practitioner getting informed consent? So like all consent, it is active and ongoing. And your consent means you have been given a reasonable explanation, expectation, and alternatives have been told to you in order for you to make healthcare decisions. Okay. And this is a big one. You get to revoke consent. So informed consent to treat can be changed throughout treatment. You're not stuck with a treatment plan, and you can ask for additions or amendments and clarification. So I just want to posit this concept. Where are you receiving healthcare information? What are your trusted sources? How do you discern and assess information about your health? I really think this is an opportunity to reflect on where you know most of the information you receive. So many times in my office, someone will be sitting there telling me that they read something online about this great new supplement and they started taking it without necessarily having a discourse or follow up with their healthcare provider to know if that's appropriate for them. Now, with the double-edged sword, I think uh, of access to information on the internet, is that we have tremendous amount of information, but we also need to be very, very critical, because there is, the fake news. There is a lot of misinformation and manipulation of facts and even from trusted sources. So, of course, this sounds very dark and grim because we become inundated with kind of fake news and who to believe and is the system against us. And um, I think it all comes back to, who can we trust? So we certainly cannot reasonably know everything about healthcare, and nor should we be expected to be an expert on every single subject. Um, and there is also obviously this trend of, do your own research. It keeps being encouraged, especially with health influencers. Do your own research, and I agree to that to a point. We should all try to be as aware and educated as we can. But my caveat to this is we also need to know our limitations and recognize that expertise gets developed over many, many years and an intensive study. They keep saying the 10,000 hours makes you an expert, but it can't really be gained by reading 25 books. So it's maybe not so much about knowing everything and having to read every side of it. Rather, it's about investing in building the therapeutic relationship so you can ask us experts, critically thinking, and making some of those critical judgments, and then asking the right questions so you can gain clarity, and also so you can assess if who you're speaking with is well versed on a subject. Okay, all of this helps you build something called your health literacy. I love this concept because this is a set of skills and a standard that gets set that includes reading, writing, numeracy, communication, and increasing use of actual electronic technology to help create better health outcomes for yourself. As healthcare providers, you would assume that we have very high health literacy, and as in the population, that health literacy is very important to start building. And ways you can do that is first to be critical. Okay, you don't have to be that person that's always, just contrary for the sake of being contrary, but it is important to question. Okay, check references when they're available, and I don't mean, read every single reference that has been made available, but if you have the time, by all means, please do. What I mean is, make sure you recognize if the source is, a WhatsApp university, or if it's an established and regulated. And by regulated, I mean there's some oversight and there's discourse before it makes it to print in that forum. Okay. The second thing I would say is be curious when developing health literacy. Okay. Normalize this idea of changing your mind. And the importance of this is because science is dynamic. Okay. You can imagine after penicillin was discovered, if everyone was just like, nah, we're good. That's not how science works. Science is curious. And in science, we pose a question or a hypothesis, and then we seek to prove or disprove it. And the results are not really up to us. We then have to validate that and challenge it and get those results a second, third, fourth time. And that's how we establish what is the gold standard and the best course of care. Okay, so be clear, um, and understand your boundaries and what your health goals are. So sometimes preparing for a visit means knowing what you want to accomplish from that visit for your health. This study in 2015, published by the American Family Physician, actually found that there were tiers of the below basic, the basic, intermediate, and proficiency, and each of them equated to different health tasks. The goal for someone like myself as a naturopathic doctor is making sure that you're landing in that intermediate to proficient. Eventually, you don't have to start right there, but eventually you should have the tools to be able to be very health literate. Okay, what this does is it ensures that, oh, we are able to effectively communicate with healthcare providers, as well as ourselves, and make informed decisions. So, how we communicate can really alleviate many sources of miscommunication. And I find that there are four primary areas within a visit that allow us to improve the transmission of information. So, this can be the language, how we present our symptoms within a visit, record keeping, and our ability to recall trends, and finally, triage or team building. When we look into the language that we use, what I mean with this is speaking with an understanding of common anatomy, and being very specific in what you're experiencing and where you're experiencing it. Now, going back to our high school biology, there are certain ways to present the information, that ensure that we are, again, being specific so that our issues can be identified without us necessarily guiding a practitioner and trying to say, okay, I have kidney stones. What we can say is, we can present information kind of as we're experiencing it in an anatomically correct way. And this is important, one, for you to feel empowered about your own knowledge, but also, again, for that accuracy. So if we know the difference between the vulva and the vagina, you can, and you mentioned that you have vaginal pain when you actually mean you have vulvar pain. This is, again, it can change where you're targeting treatment to. So vulvar pain also includes external genitalia, whereas the, no, sorry, the vaginal pain, again, is internal, and can lead to kind of a different set of testing and treatment options. It's also very important, as much as we can, to engage children in accurately identifying their organs and parts of their body, rather than using a lot of these kind of code words or keywords that sometimes have some moral association to it. So for young girls, being able to identify, again, their internal, external genitalia, same with boys. But then also just for organ systems. So it doesn't always have to be with sensitive areas, but it can also be for general health or general organs. So when we talk about kidney health, often it's related to renal. It's referred to as renal. Anytime we hear itis, it's related to inflammation. So bronchitis is inflammation of your bronchioles and into your lungs. Again, this can get quite complex, but from a basic perspective, understanding as much as possible what different organ systems are. This allows us to be specific. And the last point I would use in terms of the language that we're using is, as much as possible, try to avoid lying. And this actually really falls more to healthcare practitioners, to make sure we're creating, again, a safe space for you to not feel judged when you're describing symptoms, but understand that it's in your best health interest to be as transparent as possible relating to your habits and your issues. It's not a matter of blame. It is a matter of understanding severity or intensity of certain conditions, and again, addressing and dealing with the reality instead of something that's fabricated. Also, when there's significant disparities between lab work and what we anticipate with, what we're being told as healthcare practitioners, again, that can erode sometimes that therapeutic relationship if there is clear manipulation or lying. So as much as you can, avoid lying, and try to go to practitioners that you feel you can be very transparent with. Now, when we're describing symptoms, sometimes it is very easy to get off track or start to speak to something else unrelated. And as a holistic practitioner, I want to make sure we're understanding every part of your body and understanding that symptoms don't just happen on their own in a silo. Often it's related to many other things. So we want to understand and do a complete review of all your symptoms and systems and try to correlate different symptoms. Maybe your headache and your abdominal pain after eating are actually related, and that's all relevant information. However, it is helpful within a visit for you to describe your symptoms with as much accuracy as you can. And here's how we can go about doing that. So first, try to follow this pattern of Lo Dr. Ficara. This is a very simple mnemonic that practitioners often use just to find out and understand the type of pain or symptom that is being experienced. So the first thing is present and understand, where is this happening? What is the location? Do I have pain in my right knee, both knees? And then when did it start? Was there a significant event in and around when it started? And how long has it persisted? Does it come and go? Is it all the time? Next, you can look to where is, and again, I'm talking about pain, but it can also be, nausea or other symptoms you may be experiencing. Is it radiating anywhere if it's pain? How frequently are you experiencing this symptom? If it's abdominal pain, do you experience it after every single meal? Or is it just when you eat dairy? The intensity of the symptom. This is always really important to try to be as create a frame of reference when you're talking about intensity. You can say it hurts a lot, but to a healthcare practitioner, we don't know what a lot means for you. So if you can position it and within an event that you have experienced before, for example, if you've experienced kidney stones or birth of a child, then perhaps you can say, this is not quite as bad as the pain I experienced when when I was passing a kidney stone, maybe a 5 out of 10. Okay. Again, doctors will ask you this information, but if you can make these associations before your visit, you'll likely get a more accurate indication and diagnoses, and then better treatment and outcomes. Next, we go to the character. Try to identify and be as clear as you can about what type of symptoms or what the character is. Is it a dull aching pain? Is it stabbing? And again, I keep going to pain, but it's often kind of the clearest example. Do you tend to notice this is also associated with other symptoms? You always are nauseous in the morning, and you also have a back pain when you're nauseous, or is it always happening when you also have some abdominal pain? So try to try to identify if there is something going on at the same time. And then, of course, it's always helpful to know what you have tried and what helps it and what makes things worse. Okay, so that again is a very clear and concise way. It's like when you make your order at Starbucks, you kind of your order and you can list it off very quickly. If you can list off your Lo Dr. Ficara within a visit, it can again streamline and lead to more accurate diagnoses. Okay, write it down if you need to. The other thing that we often want to do is make sure that we're using both subjective, so how you experience, and objective, so a third party or assessment tool is being used. So this gives us more reliability and more clarity into your symptoms and how they're being experienced. So you can use a number of tools. Within a visit, a practitioner may give you assessment scales, and these are usually come in the form of questionnaires, and they help us identify and track progress. So again, let's say if you're a 7 out of 10 when you first start treatment, and then you go down to a 4 out of 10, it again is a way to rate and scale using a subjective measure, so something you are experiencing. And then we can use things like lab work or measurements that will be objective. Okay. Another exciting aspect of living in 2021 is that we have lots of tools, apps, and technology that enables us to make really to get a lot more clarity on what we're experiencing. So are you able to track your menstrual cycle through an app now, and you can also associate any vaginal discharge or pain and PMS type symptoms that can also then tell us more about your fertility. And so having that tracking is really helpful. It also helps you keep a record and helps you identify what is normal for you, because it's your body and it will be different from someone else's normal. Oh, sorry, that's kind of fuzzy. But the next area that I find is really important is, and it's remarkable how many people don't have accurate and up-to-date lab testing. Okay, what this is like I mentioned, it's an objective, so it's a marker that will tell us about internal health. And these are maybe things that we don't necessarily see all the time. And it gives us better insight into perhaps reasons or causes of an issue, and can also give us insight into, from a preventative side of things, insights into what we should potentially be focusing on and what we're at risk for. Okay, so these tests are, I kind of hate this analogy, the looking under the hood, because again, we're not cars, we're people. But that deeper insight and understanding of what's going on internally is very important, because the clinical picture and the clinical is sometimes it happens much later in the course of disease, and at that point sometimes it can be harder to treat. It's almost like at that point it's too late, or it can be the first sign. It really varies a lot, but that's why we do thorough assessments and make sure we're doing both at the same time. So lab tests can come as blood or serum tests. Life Labs is kind of the place where we all go and get you get your blood drawn. But yeah, it's referred to as serum testing. Urine tests, salivary or from your saliva or spit. Stool or fecal, this is often, again, for a lot of digestive concerns, and can be very helpful and insightful. The breath test can, again, also tell us it's used for H. pylori, it's used for small intestinal bacterial overgrowth. There's a lot of opportunity to tell us what are we expiring or breathing out and breathing in, and how is that impacting our overall health. Then, of course, there's imaging, and this is really helpful if you're experiencing a lot of pain or for any growths or lesions, so things like ultrasounds, MRIs. Then there's things like functional tests, so stress test, and the ability to see if, how are we performing? How are certain organs performing? Okay, so there's many more tests, and we like to separate them and parse them out into what are your tests that can be done, from a naturopathic perspective. What are specialized tests that will give us a deeper understanding of how your body is functioning and how we can optimize function? And what are the tests that are that more set a baseline. So I think for most people, it's appropriate to have your annual blood work done when you do your physical, and this can just be basic things like your a CBC, so that's how your red blood cells are working, and then for every individual, depending on their family history, maybe you add on or take away certain things. And in Canada, we're very lucky in that we have a lot of this coverage, so we're able to access some of those blood tests. And you have the right to ask for these tests. You have a right to establish baselines and understand what is normal for yourself. And so, if it's been a while, I do recommend you go and talk to your doctor about running blood tests. Now, where I often find people come into issues is that if it's not going to change the course of treatment. And in that case, it's very reasonable to just go based off of your your signs and symptoms if they're very characteristic of a certain condition, and having a lab test isn't necessarily going to change the course of the outcome of the treatment. Then again, it becomes save your money, save your time, and we'll continue on with this treatment. If I'm going to still tell you to eat your leafy greens and get enough fiber, then maybe I don't need to do this stool test. Again, you want to be doing this with the recommendation of someone who understands the physiology of your body, okay? An area that I find so important and that we really, really need to be more diligent about for everyone is record keeping, and record keeping for ourselves. So many people don't know that the information within a health record, so your blood work, your the visit summary that is created after you see a doctor, that information is yours. You own that. Okay, under the Healthcare Health Informations Act. So you own that information, so you can request pieces of it. The physical copy is either owned by the hospital or the doctor's office. So when you're being charged for access to your file, it's access to those physical copies. So either it's the printing fee or what have you, but technically that information and what's stored in that information is yours, and you have every right to access it, and also every right to allow others or other people part of your team to be able to access it. So I find it's very important to have thorough healthcare records for yourself. Those people who have the binders and everything has nice tabs of when they got their last blood work is they're just wonderful. And we always smile when we see patients who come in with their binders all organized. It again speaks to that health literacy and that engagement in your healthcare. You want to be engaged in your healthcare so you can make better decisions. Best way to do that is have a copy of some of the records, the treatments, what you've tried in the past, what's worked and what hasn't worked for you. Okay, it's your body. It's your your responsibility to keep these things and have some understanding of it. Okay, and it's our responsibility to make that accessible and clear for you. And this is again where it comes back to create and build a team for yourself, a team for you first. You are the first and most important advocate for your health, and then you can create healthcare providers that will communicate and triage with each other, and provide you with the most appropriate care at a given time. So I will never ever be a practitioner that says it's only naturopathic or it's allopathic, and you should never, use pharmaceutical medications. That is simply not true, and it's irresponsible to say that one person should only ever have one certain type of care. So the best thing to do is ensure that your healthcare providers are communicating with each other. And if there's resistance, again, that's the healthcare providers, and that's not your issue because you are the patient and you are at the center of this care model. And all these other practitioners, all of us here around you are really aiming to improve your health and understand your outcomes. Okay. So, what that can be is have yourself a chiropractor. Again, if you have access to these things and you have the means, have a naturopathic doctor, have a chiropractor, have your RMT, have your GP, have people on your side who are looking out for you. One of the most beautiful models in triaging and coordinating care for the best patient outcomes we see in fertility and with when a mother has chosen to have a doula, a midwife, her obgyn, all of them collaborating and ensuring that she is able to stick to her birth plan in the best way possible. And that is often a time where decisions have to be made very quickly. And if you don't have clarity on your plan, if you haven't kept your records, and if you don't, if you haven't been engaged, you may not make a decision that is best for you, and then you may have a very negative experience. So as much as we can, we want to go into these situations prepared. And ultimately, we want to make sure that the treatments we're getting, as prepared as we are, recognize, again, going back to those determinants of health, are they accurately addressing that? So, are the treatments accessible given a patient's religious, dietary, sexual, economic, metabolic, social needs? And if we have truly gotten informed consent, we are making it very clear that the treatment, to the best of our ability, addresses these needs. And if it doesn't, why it doesn't, and what alternatives there would be. So, as patients, it is your right, again, to have these preferences at least addressed. And I'm not saying in every case we're going to be able to, support the dietary or the religious or the economic, you know, aspects of your treatment, but you should be at least privy to why certain treatments are being done. So, again, this comes back to communication and having a strong therapeutic relationship where you are able to ask why, and never be shy about asking questions in a visit. Any good healthcare practitioner would welcome that and encourage you to be engaged in your healthcare. So, all this to say, how is Canada doing? How do we do in terms of, we have a lot of access to healthcare, to our basic healthcare, universal healthcare, but that doesn't always extend to pharmaceuticals that we may need, and the drugs we may need. It may not extend to alternative healthcare providers that can also help advocate for you, and support more preventative approach. How are our wait times, and how is it in terms of if you need to get imaging done or see a specialist? What is that process like? It can be quite a lot. So it's helpful to look to other countries and see what others are doing, and how, as Canadians, we can, again, also, this is part of health literacy and advocating for your health, elect officials who are looking at healthcare in a very holistic sense, and making sure they're making decisions that allow you to make better healthcare decisions, because that is a determinant of health, is what is the government system. Um, so what this study from, it was published in 2015, but it looked at the ranking, the Human Development Index ranking, from 2000 to 2012, and it was able to rank countries, you can see Canada is there at 11th place and Norway was number one. And a lot of this had to do with the integration between preventative medicine as well as acute care. There's a lot of focus on prevention and triaging. There's a lot of access to um, healthcare options, and um, again, work-life balance plays a factor here. So there was a lot to do in terms of access to drugs that can make a system really great. So when we're looking at what are our how do we fully advocate for ourselves, it also starts from a policy and from making your vote count and making sure you're in a healthcare system that allows for that. So I have kind of covered a lot of ground, but I think or hope that at the end of the day, you feel that you have the right, and you really do, to ask questions, to gain clarity, and to be curious. Because when you're curious about your health, it means you're engaged in your health and you are able to make decisions in and around your health that impact your future, um, that you can be comfortable with. Because as much as we as healthcare providers can give you insights and help you, you do understand your body, because you live in your body, and we are very much meant to be stewards or guides to support and inform you. But you are the one doing the work, you're doing the exercise, eating the diet, and making choices. It's about empowered choices. So thank you for attending my basically hour-long rant about how we all deserve and and have a right to this. But I clearly am very, very passionate about making sure we are engaged, we are educated, and we're empowered about our healthcare. So I encourage you, if this is something you want to talk more about or feel that you may not have as much information on, or how you would actually go through a doctor's visit, please feel free to reach out to us at our website or come visit the clinic. Darcy, I think if we have any questions, we can address them and go through that right now.
Perfect. Thanks, Dr. Nibber. That was great. It's nice to see that Canada ranks fairly well, don't we? So we're not perfect, but I think we're on our way, and we can take some good lessons from countries like Germany and Norway that seem to be somewhat stronger in the preventative arenas. But anyways, that was great. So we do have a question from Diane. She's asking if one of us can get a SIBO test from a regular physician. And maybe you could just say something very briefly about what SIBO is for the other listeners.
Yeah. So SIBO, or small intestinal bacterial overgrowth, is a digestive disorder where kind of the right bacteria are living in the wrong spot in your body, and it's often related to it's one of the key causes of a lot of digestive disturbance and things like IBS. And it's interesting because it was very much a fringe diagnosis, but it's so well validated now in research that it's being run more and more by gastroenterologists, and they're becoming more aware of it. So can it be run? Can the test be accessed? It depends on the gastroenterologist and their methods of practice. The breath test is not considered by the College of Physicians to be the primary diagnostic tool, so it's probably more rare. But we'll have to see in the next few years how it gets integrated. But management and awareness, the treatment for it, and again the awareness around it is very much becoming more popular and more recognized.
That's great. I actually have a question. I love your concept of having different healthcare practitioners on your team. What kind of communications is it reasonable for us to expect that, would you ever communicate with a GP, a chiropractor, or what's a reasonable thing that we could expect for communication amongst those team members?
Mhm. Thank you for asking that. That's a great point. I think everyone who has the patient's best interest at heart wants to have clear communication with others who are working on that patient on their health. So what that means is with the patient's consent, that a letter can be sent that outlines what your current treatment is, your rationale behind the treatment, and it allows professionals to communicate and discuss treatment modalities that perhaps, I would never say I'm an expert in chiropractics, and but I can certainly recognize when a referral needs to be made. So sometimes it's just a simple referral, sometimes it's more in-depth coordination of care, and that can again come in the form of letters or a requisition or a request for your health information to be sent over. And this allows us to with a lot of accuracy understand what that practitioner was already working on, so that one, we're not duplicating efforts and doing the same thing that already didn't work, because that can just prolong your treatment. And a lot of patients are left being like, but I already tried this and it didn't work. um, and also, yeah, again, we're not starting from scratch, but we are avoiding some of the we're also not um, contradicting a treatment that another practitioner had very good sound logic for. Again, we're just making sure that the overlap is appropriate and it's ultimately to benefit the patient.
Right. That makes perfect sense.
Yeah. And again, sometimes it's idealistic, sometimes we want everyone to all get along, and there's a lot of variability. I mean, we even within naturopathic doctors, there's variability in what different practitioners are comfortable with. But again, if it's a patient-centered approach, then all ego must be put aside, and it's about what's in the best interest of a patient, and patients should feel like they can advocate for that.
Mhm. I think you're absolutely right. And I think nowadays everyone is so much more informed. And we do have access to a lot of information, not all of it fantastic sometimes, but I think the people I speak with are a lot more informed about their own health and being a lot more proactive than say my parents' generation were. So I'm optimistic that with a lot of groundswell people taking that information in, we're going to even have better healthcare, and we'll maybe move our country up to number 1 or 2 or 3 in the next 10 years. You never know. Anyways, we don't seem to have any other questions here. Did you want to say any final words, Dr. Nibber, before we close off?
Yeah, thank you again for this opportunity. And if anyone would like to reach out, these are some of your options to reach out to us. Keep being engaged, and keep seeking, because the more curious we are, the more we'll progress science, and we'll progress uh, all of those determinants of health, and maybe we'll start moving the needle so that there's more in our control.
That sounds awesome. All right. So just another reminder to everyone, thank you again for joining us. And we will be sending you a link with a short survey and also asking for your mailing address so we can thank you with one of our nut bucks. So head over to Choice's website, sign up for our newsletter, and you'll also get access to our great sales. And we hope you join us on our next seminar. So thank you all again for joining us, and have a great night. Take care. Bye-bye.